Jai Hind and a very warm good morning to respected principal sir, all the respective HODs, senior faculty members, my colleagues, and dear students. Amid the global wave of pandemic, there has been rise in e-learning, and we at Subharti University also believe that this online learning can be an effective way to educate. In times where lecture halls tends to be the exception, electronic learning solutions can offer more collaboration and interaction with experts and peers, as well as a higher success rate. With this thought in mind, I, Dr. Kushbu Bhalla, from on the behalf of Department of Oral Medicine and Radiology, welcome to you all in webinar series organized for celebrating 25 years of excellence of Subharti Dental College and Hospital. Before beginning today's session, I would like to invite Dr. Sangeeta Malik ma'am, Professor, Department of Oral Medicine and Radiology, to say a few words.
Jai Hind and a very good morning to esteemed dignitaries of Subharti Group of Institutions, respected Dr. Nikhil Srivastava sir, Principal and Dean Subharti Dental College, all the HODs, faculty members and dear students. I, Dr. Sangeeta Malik, on behalf of Department of Oral Medicine and Radiology, extend a very warm welcome to all of you to another alumni webinar as a part of webinar series 2021 for celebrating 25 years of excellence of Subharti Dental College and Hospital. This webinar series is a brainchild of our principal sir and an effort to upgrade knowledge even in these trying times during COVID-19 pandemic. The topic of today's webinar is dentistry in the world of cannabis. The use of cannabis, both medicinal and recreational, is growing. Many people are getting addicted to marijuana, ignorant of its harmful effects on health. Today, cannabis abuse is a major concern because of its negative effects on general and oral health. Cannabis users are more prone to develop dental caries, xerostomia, alveolar bone loss, precancerous oral lesions, and other oral infections. It is a pleasure to announce that the guest speaker who will enlighten us on this topic is our very own alumni, Dr. Akanksha Gupta, who is making us proud by carrying forward the legacy of Subharti Dental College in the Western world. Now, I would request Dr. Kushbu Bhalla to introduce our guest speaker and carry forward the program.
Thank you, ma'am. Our today's speaker is one amongst us and our very own Dr. Kansha Gupta. Ma'am completed her graduation in 2012 and thereafter completed her post-graduation in the field of oral medicine and radiology from Subharti Dental College and Hospital, Meerut in 2017. She further pursued her master's in healthcare administration from California State University, Long Beach, USA, and graduated in the year 2020. Presently, she is working as a clinical research coordinator at the prestigious Stanford University, California, USA. She has been a part of numerous of renowned healthcare organizations in the United States, including Sutter Health, Palo Alto Medical Foundation, El Camino Hospital, and Season Hospice. Dr. Akansha has numerous publications to her credit in numerous national and international journals. Currently, she is coordinating a number of federally funded multi-site clinical and translational research studies and trials taking place at Stanford Medicine and other world-renowned research institutes such as the University of California, Los Angeles, Boston's Children's Hospital, which is the primary pediatric program of Howard Medical School, and Children's Hospital of Orange County. She is also a part of Pfizer's COVID-19 pharmaceutical studies taking place at Stanford Medicine. Ma'am has been creating awareness regarding nicotine with special emphasis on its effects in the oral cavity, including oral cancers, And now she has joined the mission of preventing students from starting or escalating use of any tobacco product as well as cannabis awareness. Ma'am, it is a great pleasure to have you with us. So without further delay, we shall begin our webinar on dentistry in the world of cannabis.
Thank you, Dr. Khushbu. Jai Hind and a very good morning to respected Principal Sir, Director of PG Studies, Dr. Vinita Nikhil Ma'am, all head of departments, faculty members, students, and fellow alumni. It is indeed a privilege to be a part of this Silver Jubilee celebration. Subharti has come a long way, and I have no doubt that under the able guidance of the executives and a principal and dean, Dr. Nikhil Srivastava sir, Subharti Dental College will reach new heights. I vividly remember the time when I presented my integrated seminar for the first time in LT4. And I remember how nervous I was. And honestly, even after all these years, I'm still getting cold feet about presenting in front of all who are masters in their field. But I'm very excited as well. I had fun preparing for this webinar. And I wholeheartedly thank Dr. Nagaraju sir, head of the Department of Oral Medicine and Radiology, for giving me this opportunity and inviting me as a guest speaker. Dr. Sangeeta Malik ma'am, Dr. Sumit Goyal sir, Dr. Swati Gupta ma'am, you are all my role models, and it is indeed a privilege to be able to present before you once again. So now, without further delay, I'm going to share my slides. Okay. So today I'll be talking about dentistry in the world of cannabis. A lot is changing about cannabis or marijuana, and very quickly. There is a global drive for legalization of this drug. There are increased users, and yet there is very little that we know about this. Moreover, there are serious dental implications of cannabis. We need to know how cannabis affects the various systems of our body. We need to know how we should plan the treatment so that we can customize it according to the cannabis users. And so I will be covering all this and more in this presentation. So let's begin. So first of all, what is cannabis? Cannabis preparations are derived from the plant Cannabis sativa. It has a very unique group of chemicals called cannabinoids, and some of them are psychoactive. That means that they lead to that characteristic high in the users or intoxication. It is known by many other names such as weed, pot, bud, ganja, charas, grass, and the effects work through endogenous cannabinoid receptor system. It also has medicinal properties and commercial utilities, which I will be discussing in further detail. But first of all, I want to talk about the prevalence of cannabis. Cannabis is the most abused drug in most countries of the world. Approximately 147 million people use cannabis globally, mainly for recreational purposes. Let's talk about India. Earliest users in the history of cannabis were the Indians. Approximately, there are 31 million users of cannabis in India, and 0.25% Indians use cannabis in a dependent pattern. According to National Drug Dependence Treatment Center, AIMS, the prevalence of current cannabis use in the total population is 2.8%. It is 5% for all males, 0.6% for females, 0.9% for children, and 3.3% for adults. So the current state of high cannabis use in India was highlighted in the year 2020, when in a sensational twist to a Bollywood actor's death case, the NCB arrested the late actor's girlfriend, her brother, and 10 others for alleged possession, transportation, and purchase of ganja and charas. So, and then the NCB got extra vigilant, and in the first fortnight of September 2020, seized more than 5,000 kgs of cannabis from various medicine and vegetable trucks across the country and arrested 13 individuals for the same. So, when I was a student in India, I never came across weed. I did not know how to use it. I did not know how it looked like. And that changed when I moved to US in 2017. So I got under the impression that maybe cannabis is common in the US, not so much in India. Little did I know that Delhi consumes more weed than Los Angeles and Mumbai more than London. According to a study by the German data firm ABCD, in 2018, New Delhi consumed 38.2 tons of weed and Mumbai consumed 32.4 tons. That is amongst the highest in the world. Let's talk about the legal status of marijuana. So India enacted the Narcotics, Drugs and Psychotropic Substance Act in 1985, criminalizing the use of fruit and flower of cannabis, but not the leaves. Today, there is a global wave of legalization. There are many who want to legalize marijuana because they think that it has medicinal properties, it has commercial value, it can eliminate illegal trade and associated crimes. So bhang is legal in India. Bhang is made from the leaves of the cannabis plant. Charas and ganja are illegal as per the International Drug Convention as well as the Indian law. In the United States, medical and recreational use of cannabis is illegal at the federal level, but as of January 2018, 30 states and the District of Columbia have legalized marijuana. And so the marijuana consumers have increased. I myself know many people who have their own marijuana stories, and they're interesting, they're funny. I know someone who searched for his phone for a good 20 minutes in his room with all the lights off, using only the flashlight of his phone. That high. You want to know how popular it is in the United States? Washington state allows for free marijuana joints with COVID-19 vaccines to encourage people to get vaccinated. It is that popular. So now that we know that it has a very high prevalence, it is very common, very popular, let's know more about this drug. So moving on to the chemical composition. Cannabis preparations are derived from the plant Cannabis sativa, and the chemical analysis shows that it has more than 500 compounds, out of which more than 120 are cannabinoids and are produced by the small glands on the surface of the plant. The main psychoactive constituent is the cannabinoid delta-9 tetrahydrocannabinol, or THC. The three main forms in which this is used is marijuana, hashish, and hash oil. Marijuana or ganja has 0.5 to 5% THC. It is relatively milder, and it is made from dried leaves and flowers. Hashish, which is similar to charas, has 2 to 20% THC and is derived from resin from flower heads compressed to form small light brown or black blocks. And then hash oil is pretty potent. It is thick, oily liquid extracted from hashish and it's the most potent form. So what is the method of use or routes of administration? In India, it is used mainly as charas, ganja, and bhang. Charas and ganja are mostly smoked, and bhang, which is made from the seeds and leaves, is taken by mouth in the form of beverage or a confection. Smoking marijuana is the most common and efficient way because it is easy to prepare, the effects are rapid. Marijuana is used as a hand-rolled cigarette, and it contains a varying amount of tobacco to assist burning, on average 0.5 to 1 gram of leaves. Then there is water pipe. There are a variety of pipes used to smoke marijuana, the most common being a water pipe or a bong. The smoke is sucked through a layer of water, which cools it and removes some of the tar and irritants. Smokers inhale deeply and hold their breath to maximize absorption. Then cannabis can be vaporized through a non-combustive heating process. It releases psychoactive compounds, which is inhaled by the user. And then there are several vaporizing models, such as pen-sized and tabletop devices that use cannabis herb, wax, or e-liquid. It is increasingly popular among adolescents, and there is stronger subjective drug effect and impairment and cognitive functioning. Then hashish can be baked and eaten in food, such as cookies and cakes, because it is soluble in fats and alcohol. Some food products contain forms of hashish with THC concentrations ranging from 2 to 20%. Hashish may also be mixed with tobacco and smoked or heated, and the vapors inhaled. Hash oil is generally spread on the tip or paper wrapping of a cigarette and smoked. Then there's another very common method called dabbing, which uses concentrated butane hash oil. So this vaporized rapidly and inhaled, has THC concentrations of 66.4 to 75.5%. And it is known as a causal factor for acute lung injury mimicking pneumonia. It is also associated with adverse events because of the high THC concentration and cause incapacitation and vomiting. Now, there is a booming market for cannabis and related products. You only need to go to Delhi's Paharganj area and you can find that sellers are competing with each other and proclaiming that they have the purest products, the kind of products that ancient rishis used to use. They have Mysore mango, golden weed, Manipuri weed, cannabis spiked pan, brownies, chocolates, and beer. They are the things of the past. Now there are products like lip balm, toffee, cheese, dried noodles. And these catchy products, they add to the appeal of weed among the youth. Now let's discuss in brief the mechanism of action. So when the marijuana smoke is inhaled, the THC in marijuana rapidly passes from the lungs into the bloodstream. From there, it is carried to the brain and other organs. This THC acts on specific receptors in the brain called cannabinoid receptors, which leads to a chain of cellular reaction that finally lead to the euphoria. And now let's discuss the pharmacology in a bit more detail. So when smoked, approximately 50% of the THC is absorbed through the lungs and enters bloodstream. This THC reaches the brain within seconds. Its effects are apparent within minutes. The peak level of THC occurs within 10 minutes of smoking, and it declines to 5 to 10% of initial levels within an hour. This THC is metabolized in the liver and forms the major metabolite, 11-hydroxy-THC, which is also a psychoactive agent. Being highly lipophilic, THC accumulates in the adipose tissues, slowly released back into the body. The tissue elimination half-life of THC is approximately 7 days, and total elimination may take up to 30 days. When ingested, the amount of cannabis absorbed is 25 to 30% less than that of smoking the same amount. And this is because of the first fast metabolism by the liver. The onset of the effect is delayed by about 30 minutes to 2 hours, but the duration of the effect is prolonged. And because the duration of the effect is prolonged, people may not realize how strong the product is. And so it is really easy to overconsume. And once you have had it, there is no going back. Now, cannabis exerts its effects on the body by interaction with specific endogenous receptors, CB1 and CB2. The CB1 receptors are primarily located in the brain and nervous system, and CB2 receptors are mostly found in peripheral organs and immune system. These receptors normally modulate the neuronal activity by affecting second messenger and ion transport system. Cannabis overdose causing death is unlikely due to the small number of receptors in the brainstem. Now let's discuss the systemic effects of cannabis, how it affects the various systems of your body. So the widespread use of cannabis is really concerning because of the negative effects on general physical health. It affects almost every system of the body. And of course, the effects depend on the dosage, the route of administration, and general health of the user. First of all, let's look at the neurological and behavioral effects because of these effects, the user experience that particular high. So there is a sense of well-being coupled with immediate cognitive and psychomotor impairment. It affects cannabis, the THC in the cannabis affects various parts of the brain, such as hippocampus, amygdala. So let's evaluate the effect on hippocampus. Hippocampus acts as a memory gateway. All the information from the word goes into the hippocampus and is stored in the long-term memory. Then from there, from the hippocampus, these memories can be retrieved. And this is important for things like forming sentences and describing experiences. Now, what happens when THC is introduced in the system? When the THC is introduced in the system, there is difficulty in learning new information. Why? Because the hippocampus becomes sluggish. And there's also difficulty recalling this information because the long-term memory and short-term memories are affected. So one way to look at the THC effect on hippocampus is, imagine someone who is high comes across an apple and he or she finds that this is the most amazing apple they have ever come across. Now, in reality, this is a normal apple. This is just an ordinary apple. But because their long-term and short-term memory is affected, they cannot recall the information that is stored in their brain. And so for them, it's like they have seen the first apple of their life, and eating that particular apple is especially enjoyable for them. Then the amygdala is affected. Most of the high that the user experiences because of the effect on amygdala. Now, what does amygdala do? Amygdala assigns emotional relevance to experiences and helps us to connect emotionally with others. And this is a very critical aspect of being human, and it is very important for survival. Talking about survival, it is also helpful in the regulation of fear. It is also helpful to recognize familiar or new events, which can awaken our interest. And it is also responsible for that feeling of awe, the wow moment that one experiences. So what happens when THC is introduced in the system? When THC is introduced in the system, then because of its effect on amygdala, the user can feel that something is very, very special about something which is very ordinary, that one sees in a day-to-day life. So, for example, suppose you come across a line of ants that is moving. Then based on your personality, you may even find this interesting, or you may just walk past by it. But if you're high, you can get really intrigued by these ants. You may observe them for a very long amount of time. You may think where these ants are going, how it feels like to be an ant. This is amusing, but that can happen. Then the basal ganglia and cerebellum are also affected. They are responsible for the motor system and the movements of the body. Basal ganglia turns the intention into instruction, and cerebellum fine-tunes the action and controls internal and external coordination. Now, when THC acts on basal ganglia and cerebellum, it has a very calming effect. The person can become almost motionless because their spontaneous movements are affected. They can become clumsy, or they may feel that it is easier to move. So some people say that they think that they become better dancers once they are high. Do you think it has anything to do with their dancing skills? No, it's just that their inhibitions are removed, the muscles are relaxed, and so they think that they are dancing really well, which may not be the case. Also, for these users, the time slows down and the distances seem larger, and their reaction time is affected. Now, can you imagine what will happen when a person who is experiencing all these symptoms is driving a car? There can be increased incidence of accidents. The chronic use of marijuana leads to addiction and disruption of brain development. Adolescents are most likely to try the drug, and they are at a critical period of brain development. Cannabis use in adolescents is associated with psychotic disorders and exacerbation of psychotic symptoms, including schizophrenic episodes. Then it has an effect on cardiovascular system as well. The acute effects of THC include a dose-related tachycardia of up to 50%. There is widespread vasodilation and microcirculation disruption. An elevated heart rate increases cardiac workload and myocardial oxygen demand. This results in cardiac ischemia in susceptible individuals. There can be myocardial infarction to stroke. It can also lead to vascular occlusive disease called cannabis arteritis. There are case reports of sudden cardiac death during intoxication. According to one study, there is a greater risk of increased systolic blood pressure after cannabis use. Concentration of carboxyhemoglobin from absorbed carbon monoxide is high because of the smoking pattern, which is deep inhalation and long inspiratory time. It decreases the oxygen level to the heart. Also, the analgesic properties of THC may delay the treatment of chest pain related to stable angina or angina pectoris. Then the effects on the respiratory system are associated mainly with the long-term use of smoking marijuana cigarettes. So the marijuana cigarette has the same contents as tobacco smoke except the nicotine. It has carbon monoxide, bronchial irritants, tar, high levels of other carcinogens than the tobacco smoke. And so the users can experience symptoms of bronchitis, including coughing, wheezing, sputum production, and emphysema. The pulmonary effects of long-term use of 3 to 4 marijuana cigarettes a day is equivalent to smoking 20 or more tobacco cigarettes a day. And this is because of the pattern of smoking, which is deep inhalation, and absence of a filter in marijuana cigarettes. Smoking one marijuana cigarette results in the inhalation of 3 times the amount of tar and 1/3 more tar retained in the respiratory tract compared to one tobacco cigarette. Now, alveolar macrophages, which are the key cells in respiratory defense, are found in greater number in marijuana smokers. However, their ability to phagocytose is impaired, predisposing the individual to respiratory infections. THC also has an impact on immune system, and it is really important. Cannabinoids modulate immune cell functions. There is widespread distribution of CB2 receptors in immune cells. They have the immunosuppressive effect on macrophages, natural killer cells, T and B lymphocytes. It leads to decreased host resistance to bacterial and viral infections. So these immunosuppressive effects, they are caused by suppressing lymphocyte proliferation and antibody production to cytotoxic activity. The normal function of macrophages are suppressed, and by inhibiting the release of nitrous oxide and antibacterial effector molecule and other important cytokines of the immune system. These inhibited cytokines include TNF-alpha, interleukin-6, and PGE2, which are normally secreted by macrophages in response to bacterial endotoxin and lipopolysaccharide. THC also increases interleukin-1 secretion and processing by the macrophages. Interleukin-1 is associated with apoptosis or programmed cell death in human mononuclear leukocytes. Furthermore, cannabinoids suppress host immune reactivity against tumor growth. The endocrine system is affected as well. The cannabinoids decrease androgen and prolactin concentration. It may result in suppression of gonadal function, leading to impaired sperm morphology and function, and gynecomastia in male, and evolution and galactorrhea in females. The other physiological effects include cannabinoid hyperemesis syndrome, which is characterized by recurrent episodes of severe nausea, vomiting, and abdominal pain, as well as dehydration and electrolyte abnormalities. Also, there are case reports of severe bleeding, which is associated with non-FDA approved synthetic cannabinoids. There is unexplained persistent bleeding in the setting of greatly elevated prothrombin time and INR. And this bleeding persisted despite the administration of intravenous vitamin K and fresh frozen plasma. The mechanism of action is thought to be potential synthetic cannabinoid warfare interaction. Now let's move on to the oral manifestation of cannabis. Now, the use of cannabis or smoking marijuana is generally associated with poor quality of oral health. The etiology is complicated by a number of associated factors such as concomitant use of tobacco, alcohol, and other drugs, poor oral hygiene practice, and infrequent visits to the dentist. So the first oral manifestation that I want to discuss is xerostomia, dry mouth, or in this case, cannabis cotton mouth. So in a vast majority of users, the users suffer from xerostomia with effects lasting between 1 to 6 hours after use. So what happens is that the activity of cannabis compounds on cannabinoid receptors in the large salivary glands reduces the parasympathetic activity, which leads to reduced salivary flow. A study conducted by Darling et al. Aimed to determine the oral effects of cannabis found that dry mouth was experienced by 69.6% of its participants after smoking cannabis, compared to 18.6% of the cigarette smoking control group. Then there is one study by Dicugno et al. It showed that the pH of the test group using cannabis was 6.9, whereas the pH of the control group was 7.51. Person who uses cannabis has a reduced saliva buffering capacity than someone who does not use cannabis. Cannabis can also lead to dental caries. So in many studies, authors have found that there are carious lesions in cannabis users, particularly on the smooth surfaces. And this smooth surface decay is particularly concerning because such surfaces are typically easy to clean with regular oral hygiene care methods. Now, why this can happen? So I just discussed xerostomia. Xerostomia is a strong risk factor for dental caries. Also, it has been found that cannabis users brush their teeth less frequently, and there's less frequent visit to the dentist as well. Then the dietary pattern of cannabis users may also facilitate tooth decay. So the THC in marijuana is an appetite stimulant, which inclines users to consume greater amount of carcinogenic food. Through the effect of cannabis on leptin, a cannabis user is hungry immediately after cannabis consumption. And in a survey, it was found that 63% of those who felt hungry post-cannabis use had consumed sweet foods and drink. Also, there are high level of decayed missing filled teeth scores. In a study conducted by Catabesh, the test group consisting of cannabis users had 6 times as many decayed surfaces compared to the control group. So to summarize, I can say that reduced saliva production, decrease in saliva pH, increased appetite, leave teeth vulnerable to attack from potentially carcinogenic food and drink. Now we know that nicotine causes tooth staining, but marijuana can also cause nicotine-like staining of the teeth. Then there is oral candidiasis. I discussed in my previous slides that cannabis suppresses the immune response of the body. So this immunosuppressive effect of cannabis can also aid in oral candidiasis. Also, it has been hypothesized that the hydrocarbons present in cannabis can provide an energy source for Candida albicans, which can lead to increased presence and density of colonies. Alternatively, poor oral hygiene among many cannabis smokers can promote candidiasis. It has also been found that viable microbiota may be transmitted from contaminated marijuana, which can further exacerbate a pathogenic oral environment. Then there can be thermal injuries. Cannabis has a higher combustion temperature than tobacco, and so it can lead to thermal injuries of the oral soft tissues. Of course, the frequency, duration, and mode of intoxication has an effect on the degree of thermal injury. Then leukoedema is a bilateral diffuse translucent grayish thickening, particularly of the buccal mucosa, and it is considered as a variation of normal. But this has been found that it is more common among cannabis users than non-users. There can be cannabis dermatitis. Smoking marijuana can lead to erythroplakia and chronic inflammation of oral mucosa with hyperkeratosis and leukoplakia, which is sometimes referred to as cannabis dermatitis. And this can develop into malignant neoplasia. Which brings us to our next question. Can cannabis lead to oral cancers? Cannabis contains an array of carcinogens, including phenols, nitrosamines, vinyl chloride, and various polycyclic aromatic hydrocarbons. The quantity of tar inhaled and retained in the lower respiratory tract is higher in cannabis smokers in comparison to tobacco smokers. Also, cannabis smoke contains 50% more of the carcinogenic hydrocarbons than tobacco smoke. Moreover, the synergistic effect between tobacco and cannabis smoke may increase oral and neck cancer risk for people who smoke both. The risk and aggressiveness of cancers associated with cannabis appear to be higher in younger population than older. Then the immunosuppressive effects of cannabis in association with oral papillomavirus in smokers may contribute to increased risk of cancer. In a 2020 study, THC in the bloodstream may accelerate the growth of biomarker associated with HPV-related head and neck cancers was found. However, there are other studies in which no association was found between oral cancers and cannabis use. Then there is a very strong evidence that cannabis can cause periodontal diseases. In many studies, significantly higher rates of periodontitis has been found in frequent users compared to non-users, and significantly higher number of sites with high pocket depth of more than 4 mm and attachment loss. Also, the periodontitis may occur at earlier stage. In a histometric experiment, the laboratory rats exposed to marijuana smoke had a significant increase in alveolar bone loss due to periodontitis, despite research that has indicated that specific cannabinoids such as CBD may prevent bone loss. There was a research published in the Journal of Tennessee Dental Association which said that chronic marijuana use may result in gingival enlargement with clinical characteristics similar to phenytoin-induced enlargement. The marginal and papillary gingiva of the anterior dentition were the areas primarily affected by gingival enlargement. Some of these areas exhibited a nodular or pebbly appearance. The biochemical similarities between phenytoin and cannabis active compounds can be the possible common pathogenic mechanism. The other common findings in that study included nicotinic stomatitis-like lesions and uveitis. This chart shows the gingival enlargement associated with marijuana use. Many authors conducted a study and found that there was gingival enlargement in patients who had marijuana. And this chart shows that uveitis has been associated with marijuana use as well. Now let's move on to dental care implications. How to deal with cannabis users in dental clinic. Clinical challenges have been identified in the literature at 3 points, that is, history taking and informed consent, treatment planning, and routine follow-up. So many dentists in the United States have reported difficulties obtaining a cannabis history in states where cannabis is still illegal. Also, the intoxicated patients have memory loss and their perception is impaired. And so the altered mental state impairs the ability of the patients to provide informed consent. So that is especially important when you're going to do an irreversible procedure such as extraction. Then also the treatment planning. The treatment should be customized according to these patients to provide an optimal care. And for that, we need to know the effect of marijuana on various dental procedures. So let's do that. Marijuana can affect surgeries and anesthetic procedures. Let's see the preoperative considerations. Before performing any surgery, we need to ask about the duration, frequency, and route of use. It is necessary to ask about the most recent intake and to reassure the patients that the information is only being used to help guide safe perioperative care. We need to assess for the signs and symptoms of acute intoxication because the most concerning anesthetic implications are related to acute intoxication. If patient exhibits central nervous symptoms of acute cannabis intoxication, assess for symptoms of escalating anxiety, paranoia, or psychosis, because these may result in a more violent emergence from the anesthesia. Then there can be episodes of cannabis-induced psychosis, especially after use of higher potency THC formulations. This can co-present with fever, tachycardia, and hypertension. And these symptoms could be mistaken for other conditions with similar symptom clusters, such as malignant hyperthermia, serotonin syndrome, neuroleptic malignant syndrome, or thyrotoxicosis. Cannabis withdrawal has a presentation similar to other withdrawal disorders, and careful and directed history taking may help identify the at-risk patients. If a cannabis user has a history of angina, then we should consider delaying the elective surgery for an hour after the use. This is because the elevated risk of MI resolves an hour after the cannabis use. We can delay the anesthetic induction until resolution of tachycardia or postural hypotension in acutely intoxicated patients. Now let's move on to the intraoperative considerations. It has been found that cannabis users require higher induction doses of propofol and may require greater analgesic use in the intraoperative phase. So a multimodal perioperative analgesic approach can be used, utilizing acetaminophen and NSAID or a cyclooxygenase 2 specific inhibitor combined with a local or regional analgesia technique. Now, what are the postoperative considerations? So doctors need to remain vigilant to preventing symptoms or potential cannabis-related adverse effects, particularly the withdrawal symptoms. Cannabis users report higher pain scores, they have worse sleep, and they require more rescue analgesics in the immediate postoperative phase of care. Now, an article was published in the renowned OOO journal in 2018 that evaluated the effects of cannabis use on patients undergoing office-based anesthesia. So they evaluated for the preoperative, intraoperative, and postoperative differences to determine the most effective way to consistently achieve adequate and safe sedation in this population. They found that the use of diazepam rather than midazolam led to improved sedation experience and lowered intraoperative use of other medications such as fentanyl, propofol, and ketamine. Postoperatively, there was quicker emergence from sedation and there was less nausea and vomiting. Now let's look into the dental procedures that involve the use of epinephrine. So increased heart rate and other cardiorespiratory effects of cannabis make the use of epinephrine in local anesthetics potentially life-threatening. So administering epinephrine or products containing alcohol to a high patient can be dangerous. There can be increased anxiety and paranoia in these patients, and dentists may refuse to treat the intoxicated patient or consider postponing non-emergency treatment for at least 24 hours. Cannabis has also an effect on the dental implants. There was one study that investigated whether marijuana smoke influences bone healing around titanium implants, and it revealed the deleterious impact of cannabis sativa smoke on bone healing. So, marijuana usage can lead to bone loss. The increased THC in a person's body leads to the acceleration of bone loss around the teeth. And this is true for the natural teeth with their own root system, as well as dental implants with an artificial root system. There is reduction in the density of the alveolar bone, which anchors your teeth, and so dental implant might fail to integrate into the site of implantation. There is effect on orthodontic treatment as well. And ongoing research indicates that cannabis consumption influenced the alveolar bone remodeling initiated by orthodontic force at cell and tissue level. This is an ongoing study, and we will know more what exactly happens once the study is completed and the results are published. Now, how to identify a cannabis user in the dental clinic and how to manage it? So, the Diagnostic and Statistical Manual of Mental Disorders, the standard used by mental health professionals, exclusively uses behavioral criteria for the diagnosis of cannabinoid intoxication. These symptoms include recent history of cannabis use, exhibition of considerable behavioral or psychological changes such as euphoria, impaired judgment, and motor skills, and at least two of the following signs: red eyes, dry mouth, increased appetite, or tachycardia. Dental care providers should consider these behavioral and psychological signs and symptoms before initiating the treatment in a patient who reports cannabis use. A mini mental state examination has potential for use in the clinical environment for assessment of cognitive impairment. Now, what is this mini mental state examination? This is a screening tool developed by Falstein and colleagues in 1975, and it was developed mainly for the mentally ill patients, but it has been used for clinical assessment of substance users. It includes 11 short questions that focus on the cognitive aspects of mental functions, and it takes hardly 5 to 10 minutes to complete. So this slide shows what mini mental state examination is, what the questions are, how the scoring is done, and how the interpretation is done. Now, what to do if a dental healthcare provider suspects cannabis use? So maybe they should use questionnaires and include questions about cannabis use in a thorough dental and medical history. According to one study, participants are more susceptible to underreporting cannabis use when asked face-to-face than if asked through a questionnaire. Also, I have just discussed the oral manifestations. So if you find all these symptoms, all these characteristics in the oral cavity, then you can suspect a chronic recreational cannabis user. Then what advice can we give if a recreational habit has been uncovered? So first of all, we have to acknowledge in a non-judgmental manner that a patient has disclosed a very sensitive information about himself or herself. So, and patient should be made aware that all the information will be kept confidential. Don't immediately warn about the dangers of cannabis because this can create a defensive reaction, raise anxiety levels, and create a barrier between the physician and the patient. Leave the discussion towards a dedicated period where you can, in a very short period of time, you can discuss about the habit and patients' motivation to stop using cannabis should be gauged, and the advice should be tailored to their desire to quit. Then we need to emphasize the importance of regular dental visits and oral care. We need to encourage healthy nutritional snacks over sweet caloritogenic snacks. Consider employing preventive measures such as topical fluorides. Consider treatment of xerostomia while avoiding alcohol-containing products. And of course, keep advised of current changes in applicable laws on recreational or medicinal cannabis. Now let's move on to the very interesting part of the presentation, that is cannabis as medicine. We know that cannabis works through an endogenous cannabinoid receptor system, and the discovery of this system in the late 1980s prompted the researchers to explore a wide range of potential medical applications of cannabis. Cannabidiol is one of several cannabinoids found in the cannabis plants. And unlike THC, it is non-psychotropic. It does not cause any high in the patients. And it's been known to provide some relief from conditions such as anxiety, depression, insomnia, pain, and epilepsy. Some studies have found that it has anti-inflammatory and antibacterial properties. There is synthetic oral THC medications called Nabilon and Dronabinol, which are prescribed to reduce nausea and vomiting related to chemotherapy and treatment of AIDS. There are many ways of administering this medical cannabis. It can be used in a botanical, that is smoked form. It can be added as an ingredient in food. It can be inhaled as a vapor or mist, applied topically, or ingested as a pharmaceutically manufactured medication. Now the CBD, which is a non-psychoactive element that is derived from hemp, which is cannabis. It's a form of cannabis. In USA, over-the-counter CBD products and dietary supplements containing or derived from cannabis are not FDA approved. However, there is an exception. There is this medicine called Epidiolex. It contains a purified form of CBD, and it is used to treat seizures associated with two rare and severe forms of epilepsy. This is called Lennox-Gastaut syndrome and Dravet syndrome. Now let's see how CBD can be used in oral care. There is some evidence that CBD can eliminate decay-causing bacteria. This study was published in a reputed PubMed Index journal that compared the efficacy of cannabinoids versus commercial oral care products in reducing bacterial content from dental plaque. So what they did was 60 adults were categorized into 6 groups. Dental plaques were collected and they were spread on 2 divided Petri dishes. Then they were treated with different oral care products, and these Petri dishes were sealed and incubated, and then later the number of colonies were counted. So what they found was that cannabinoids were more effective in reducing the bacterial colony count in dental plaques as compared to Oral-B and Colgate. So we can say that probably they have the potential to be used as an effective antibacterial agent against dental plaque-associated bacteria. And also they can act as a safer alternative for synthetic antibiotics to reduce the development of drug resistance. So this article was published in 2020, this news article that says that Colgate is going to acquire a brand with new CBD line of toothpaste and mouthwash. Then the CBD can also be used to treat anxiety as an alternative to sedation. While THC has anxiogenic effects and can trigger anxiety, CBD has anxiolytic effects. And so there is potential for CBD to counter symptoms from a variety of anxiety disorders in short-term applications. There is potential for treating acute anxiety, and it could prove useful for treating dental anxiety. CBD may help reduce feelings of discomfort and panic attacks at the dentist. Patients may be able to eschew traditional types of sedation like nitrous oxide and oral sedation and their side effects, and still get relief from their discomfort and anxiety during their treatment. It has also been known to reduce inflammation. It has powerful anti-inflammatory effects, and so it has the potential for treating the inflammation caused by oral surgery, such as dental implants. It can relieve inflammation caused by gum diseases, and it can also control inflammation after certain periodontal treatments. It can also be used in pain management because it has strong analgesic effects, and it can be used to treat difficult to manage pain. It is a potential alternative to other pharmaceuticals in the management of pain after oral surgery, like tooth extraction or implant placement. It may also be helpful in temporomandibular joint disorders. CBD oil can reduce these TMD symptoms. Now, CBD doesn't fix the cause of TMD, but because it has analgesic and anti-inflammatory properties, it can calm down the inflammation in the joint and help with the pain. So there was this randomized double-blind trial published in the Journal of Clinical Medicine. Patients with TMD in the test group applied CBD ointment topically to the joint twice daily for 14 days, and the control group used a placebo ointment. After 2 weeks, the CBD group reported a 70% reduction in the pain, and placebo group saw their pain decrease by just 10%. In a 2017 study, researchers investigated how CBD could treat the pain associated with osteoarthritis. So the study concluded that CBD administration inhibited the pain and peripheral sensitization in established osteoarthritis. CBD may be a safe therapeutic to treat osteoarthritis pain locally and block the acute inflammatory flares that drive disease progression and joint neuropathy. Then we know that that the cancer patients go through chemotherapy and radiotherapy. And these therapies don't only kill the tumor cells, they also affect the adjacent normal cells. And that can be very painful and lead to oral mucositis. The recent literature review concluded that the antioxidant, anti-inflammatory, and analgesic properties of CBD could be compatible treatments for oral mucositis. There can be various ways to use CBD for oral care. You can use it in CBD toothpaste, edibles, capsules, CBD oils, tinctures. And tinctures are extremely potent CBD extracts. You put them beneath your tongue and wait for them to get absorbed. And they are used for inflammation and pain with instant effects. Now, there are certain risks of CBD as well. It can lead to prolonged or exacerbate tachycardia and hypertension. It can potentiate cardiac arrhythmias and respiratory depression under general anesthesia. It can increase the drowsiness caused by some drugs such as benzodiazepine, codeine, and some antidepressants. It can interact with sedatives, central nervous system depressants, pain relievers, and analgesics. There can be increased risk of bleeding events when it is taken with aspirin or other NSAIDs, blood thinners, or antiplatelet drugs. It can also affect the sugar levels among patients taking diabetic medication. The use of CBD is associated with special precautions and warnings. So in pregnancy, it is unsafe when it is taken by mouth or smoked because the THC passes through the placenta and it can slow the growth of the fetus. There can be low birth weights in infants, and it can also lead to childhood leukemia and abnormalities in the fetus. It is likely unsafe in breastfeeding because THC in marijuana passes into breast milk and it can slow the development of the baby. It can lead to weakened immune system, and so it can be difficult for the body to fight infections. It can lead to heart diseases. It can lead to rapid heartbeat, short-term hypertension, and increased risk of having a heart attack. It can lead to lung diseases such as lung cancer. Several cases of unusual type of emphysema has been found. In some patients, CBD can help to control seizures, but in some cases, the seizure disorders can get worse. When it affects the surgery, it can slow the CNS too much when combined with anesthesia and other medications during and after surgery. And so you need to stop using marijuana at least 2 weeks before a scheduled surgery. Now, let's move on to the last part of this presentation, which is cannabis and COVID-19. Yes, they have a connection. So the process of inflammation is important in the pathogenesis of COVID-19. We all know that. Cannabinoids are effective at suppressing immune and inflammatory functions. And so it has a potential to act as an anti-inflammatory treatment in COVID-19. So the most severe, most critical cases of COVID-19 suffer from acute respiratory distress syndrome. What happens is after COVID-19 exposure, the body defends against viral invasion with an immune response. There is release of various cytokines such as granulocyte macrophage colony stimulating factor and interleukin-6, chemokines, and inflammatory mediators. This triggers the inflammatory cytokine storm, perhaps by shifting the Th1 and Th2 cytokines, and there can be cytopathic effects and mortality. So the physiological effects of cannabis and cannabinoids are mediated through the human endocannabinoid system. The activation of ECS by cannabis and cannabinoids-based therapeutic regime exerts an immune regulatory properties. The ECS-mediated immunosuppression includes cytokine suppression, inhibition of immune cell proliferation, migration, and antibody production. So it has been hypothesized that cannabinoid receptors could be therapeutic targets in the COVID-19 pandemic. Therefore, it is of interest to determine whether cannabinoids can quell the inflammatory cytokine release by SARS-CoV-2 and reduce the mortality caused by COVID-19. So now I've reached at the conclusion. To conclude, I would say that the substance may show promise, but more research needs to be performed. Anybody who has any knowledge about cannabis, who is studying cannabis, can tell you that we do not know about the long-term effects of this drug. Much of the research that has been done have analyzed the effects of THC at concentrations of 12 to 14%, when we know that some commercial products are as strong as 95% in THC. The federal government in US is funding research into medical uses of cannabis, and so we may soon have a better understanding of CBD uses and interactions. And while waiting for further evidence, dental professionals should familiarize themselves with scientific knowledge and tools required to facilitate the care for patients with acute or chronic features of cannabis smoking. These are my references. And now, if you have any questions, I'll be happy to answer them. Thank you.
Thank you, ma'am. Ma'am, we have few queries. First is from Manvi Agarwal. Ma'am, our question is, since cannabinoids were more effective in reducing bacterial colony than in dental plaques, than Oral-B and Colgate, so it means we can safely use CBD in toothpaste and mouthwashes?
Okay, thank you for the question. This is a great question. We need to understand that this research was an in vitro research. This was a preliminary in vitro research. And to determine the long-term safety and efficacy of anything, we need in vivo clinical trials. So we do not have these clinical trials. And also, it is very important to reproduce these results. Some other scientists should conduct this research again, and the results should be reproducible. And this is especially important because in this research, there was a financial stake. I mean, there was a conflict of interest. So I personally would not use CBD toothpaste until I have more research at hand and more data is published. Thank you.
Thank you, ma'am. Ma'am, there is another query from Shreya Tripathi. She says, what is the adequate dosage of CBD for the management of various health conditions?
So as I mentioned earlier, that the only FDA-approved drug that has CBD is Epidiolex, which is used for the treatment of seizures. The dosage for that Epidiolex is 2.5 mg per kg body weight given twice a day. And you can increase this dose to 5 mg per kg twice a day. That's the maintenance dose. And if that dose is well tolerated and you need further management of the seizures, then you can increase this dose to the maximum acceptable level, that is 10 mg per kg body weight given twice a day. But other than that, there is no universal dosage of cannabis for patients. In fact, there are several studies that have found that various individuals or various animals in animal studies respond to various dosage of cannabis, and this can be due to different body weights or the treatment, the condition for which this treatment is given. So most of the human studies that have been performed, they used the levels of cannabis as low as 20 mg to as high as 1500 mg. And there are some products available in the market that recommend the use of 25 to 30 mg, but that can be too low for some patients who have temporomandibular joint disorders or who are suffering from anxiety. They may need 16 to 90 mg. But again, I would want to emphasize on the fact that we do not have enough studies. We do not have clinical trials. We need more studies to come up for a dosage for different diseases and problems.
Thank you, ma'am. And thank you, Manvi and Shreya. I hope all your doubts are clear now. Thank you so much, ma'am, for throwing some light and sharing your knowledge on this topic of our field. You have so finely and beautifully explained this topic, and I'm sure all of us must have benefited from it. Now, I would request our principal, Sir Dr. Nikhil Srivastava, to kindly say a few words.
Hi, Akanksha.
Good morning, sir.
Good morning. Thank you so much for enlightening everyone. And I'm so happy to see you growing and ever smiling, a passionate girl now in US and doing such a good job and carrying forward the legacy of Subharti. So we are really proud of you. That's wonderful. Akanksha, I mean, your lecture was really very, very nice and knowledgeable. And then I think that we can have a collaboration. Just think about it. And then if we can have a collaboration between two institutions, that will be a great idea. And then our Department of Oral Medicine and Radiology will work on this.
It will be an honor, sir. We'll definitely discuss about this. Thank you.
And then you can, be in touch with the faculty of Oral Medicine and Radiology.
Sure. Of course, sir. Definitely.
So thank you very much. I mean, we are celebrating 25th year of excellence, and then I hope that you will, in near future, you will come and visit Subharti and see how our institution is going.
Yes, sir, definitely. I really want this COVID thing to get over soon, and I so want to meet everyone in person.
Great. Thank you so much. And on behalf of Subharti Dental College, it is my privilege to present to you this certificate of appreciation for the wonderful lecture.
Thank you, sir. Thank you so much.
And
it was an honor to be.
Thank you so very much. Thank you. Bye-bye. Jai Hind.
Jai Hind.
Thank you so much, sir, for your kind words. On the behalf of Department of Oral Medicine and Radiology, I would like to thank our guest speaker, Dr. Akansha Gupta ma'am, once again for sparing her valuable time and educating all of us. We would also extend our heartfelt gratitude to Dr. Atul Krishna sir and late Dr. Mukti Bhatnagar ma'am, founder, Subharti Group of Institutions. Also, we would like to extend a sincere thanks to our young and dynamic Chief Executive Officer, Subharti University, Dr. Shalya Raj ma'am, for motivating us always to organize such educational events even during COVID times. Thank you, ma'am, for being our pillar of strength and support. We would also like to thank our Honorable Vice Chancellor, Subharti University, Dr. V.P. Singh sir, for his love and support throughout. We would also like to extend our sincere and heartfelt gratitude to our principal and dean, Dr. Nikhil Srivastava sir, for always believing in us and pushing us to do better every time. Thank you, sir, for all your support and encouragement throughout this entire event. I would also like to thank our head of the department, Dr. Nagaraju sir, and all the faculty members, Department of Oral Medicine and Radiology, for support and guidance throughout the webinar. Last but not the least, we also convey our thanks to Mr. Vishal Singh sir and Mr. Sumit Rathi from the Department of Marketing and Communication for smooth and uninterrupted conduction of this online webinar. In the end, thanks to all our participants for their patient hearing. Jai Hind, stay safe, and have a great day to all of you. Thank you.